Good morning. If you're just tuning in, welcome to APAICS's inaugural Health Summit. I'm Madeline Milka, President and CEO of APAICS, the Asian Pacific American Institute for Congressional Studies. Thank you for joining us as we dive into a panel discussion on diversity and equity in the healthcare industry. I'd like to thank our event partner Novo Nordisk for their support of our opening panel and event partner Amgen for supporting this upcoming panel discussion. Before we begin, it's my honor to introduce Congressman Bobby Scott for opening remarks. Congressman Scott currently represents Virginia's 3rd District in the United States House of Representatives. He is the chair of the House Education and Labor Committee, which has jurisdiction over initiatives aimed at strengthening the healthcare industry workforce. He is also a strong supporter of the AANHPI community and is also a member of the Congressional Asian Pacific American Caucus, also known as CAPAC. We are thrilled to have him join today, so please join me in welcoming Congressman Bobby Scott.
Hi, I'm Congressman Bobby Scott of Virginia's 3rd District, and I chair the House Committee on Education and Labor. I want to start by thanking APAICS for hosting this discussion and supporting our nation's AAPI healthcare workers. AAPI representation in the healthcare workforce is critical to expanding access to quality care for AAPI communities both during the pandemic and beyond. Regrettably, the AAPI healthcare workers have not only faced continued discrimination, hate crimes, and xenophobia, have also been left exposed to workplace COVID-19 infections. According to the CDC, more than half of the COVID-19 cases or deaths among healthcare workers have included AAPIs or other people of color. That's why the Education and Labor Committee has been working hard to protect the safety of vulnerable healthcare workers. Over the past year, we've repeatedly urged the Occupational Safety and Healthcare Administration to issue an enforceable emergency workplace safety standard that protects workers against COVID-19. Unfortunately, the Trump administration never did. But I'm pleased to report now that the Biden administration is expected to issue such a standard very soon. Just this week, the House passed the Protecting the Right to Organize Act, the PRO Act. This historic bill secures workers' rights to stand together and negotiate for higher pay, better benefits, and safer working conditions. This Congress, I'm also working to pass the Workplace Violence Prevention for Healthcare and Social Service Workers Act. This bill would protect healthcare and social service workers who face disproportionately high rates of workplace violence. I'll also reintroduce the Direct Care Opportunity Act, which invests in recruiting and developing our direct care workforce so that we can respond to the needs of our aging population. The committee will also work to update the Workforce Innovation and Opportunity Act to help dislocated and underemployed workers access high-quality career pathways in high-demand sectors, including healthcare. These are just a few of the steps we're taking to stand up for healthcare workers, but we know we must do far more to support those who risk their lives each day to protect our health and safety. So thank you again for your leadership in supporting AAPI health professionals and all healthcare professionals, and I hope you have a productive summit.
Hello.
Thank you, Congressman Scott, for your leadership and for your remarks. I'd like to now introduce Congressman Ted Lieu. Congressman Lieu represents the 33rd Congressional District of California, where he serves on the House Judiciary Committee and House Foreign Affairs Committee. Congressman Lieu is an ardent supporter of the AANHPI community and serves as whip of CAPAC. We're also honored to have him as an alum of our national leadership training, having gone through the APAICS program when he was a member of the California State Assembly. We're thrilled to have him with us today, so please join me in welcoming Congressman Ted Lieu.
Hello, I'm Congressman Ted Lieu, and I want to thank APAICS for holding this important virtual summit on diversity and equity in healthcare. The pandemic has exposed a number of issues in the Asian American community that we need to address. For example, we know that Asian Pacific Islanders die at far higher rates from COVID-19 than the average population. One reason for this is a lack of access to high-quality, affordable healthcare. That's why I support our efforts to strengthen the ACA, and we need to put in a public option into the ACA. At the same time, the reason we know that Asian Pacific Islanders have these disproportionate effects is because of data disaggregation. I fully support all efforts to disaggregate data within the diverse Asian Pacific American communities. Another issue we've seen is the importance of essential workers to Americans and to our economy and to our healthcare. We've had essential workers in the healthcare industry, those who, for example, are grocery store clerks, those who work in transportation, in a variety of sectors to make sure that Americans, when they got sick, were cared for, that we could get food, that we could be moved around with transportation. And when you look at the essential workers, we know that a number of them are undocumented. In fact, among the undocumented population, 3 out of 4 work in jobs classified as essential. And some of them are Asian. That's why I have supported legislation and am a co-lead with Congressman Joaquin Castro, along with Senators Elizabeth Warren and Alex Padilla, to provide a pathway to citizenship for essential workers who are undocumented. They risk their lives for us. We should give them citizenship. Another issue related to healthcare is simply making sure that you're not attacked, that you're physically and mentally protected from assaults. And unfortunately, we've seen during this pandemic a rise in hate crimes and hate incidents against the Asian Pacific American community. We know that since the pandemic started, there's been over 3,000 hate incidents and hate crimes. That is completely unacceptable. I was recently on a press conference with Speaker Pelosi and members of the Latino, Black, and Asian American caucuses in Congress, led by Judy Chu, who put on the press conference. And we made the point that we need to report these crimes and get prosecutors to prosecute hate crimes and also get the federal government much more involved. Last term, unfortunately, we had a former president who would use racist phrases like Kung Flu, that fueled hatred against the Asian Pacific American community. That also helped increase the number of hate crimes against the community. Unfortunately, that kind of passion and that kind of prejudice we need to reduce, but it takes time to reduce all this prejudice and passion that was riled up last year. I wrote a letter, a bipartisan letter signed by over 150 members of Congress to then Attorney General Bill Barr to do more on hate crimes. He never responded. Under Merrick Garland, the incoming Attorney General for the Department of Justice, we're going to write another letter. And I'm confident that he is going to respond and do more on hate crimes. And we've already seen President Biden sign an executive order specifically on the Asian American community and on hate crimes. So we're going to work hard with the administration to mitigate the number of hate crimes against the Asian American community. And if you suffer hate crime or know someone that did, please make sure that it is reported to the proper authorities. Thank you again to APAICS for all that you do, and look forward to working with you to make America an even better place to live, work, and play.
Thank you, Congressman Lieu. It is now my privilege to introduce the moderator of our panel, Juliet K Choi. Ms. Choi is the Chief Executive Officer of the Asian and Pacific Islander American Health Forum, and a national health justice organization which influences policy, mobilizes communities, and strengthens programs and organizations to improve the health of Asian Americans, Native Hawaiians, and Pacific Islanders. Serving as a senior executive, she served in the Obama administration as the former chief of staff and senior advisor of 2 federal agencies, the U.S. Citizenship and Immigration Services at the U.S. Department of Homeland Security, and the Office for Civil Rights at the U.S. Department of Health and Human Services. As a reminder to the audience, please submit your questions in the comment section if you're watching on Facebook or YouTube. Juliet, I turn it over to you.
Thank you, Madeline, for that really kind and generous introduction. Now I have the honor of introducing our distinguished panelists who are joining us today. Dr. Mary Joy Garcia-Dia is the president of the Philippine Nurses Association of America, PNAA, and is currently a program director at New York Presbyterian Hospital. She's always been passionate and active in the nursing community, raising educational awareness and addressing the underrepresentation of minority health and through community engagement. Linda Murakami leads the U.S. and global bone, breast, and prostate advocacy relations portfolio for Amgen, where she develops and executes Amgen's engagement strategy with patient organizations, professional societies, and other critical stakeholders for oncology. She started her career working in the office of the late U.S. Senator Daniel K. Choi, and continued her career advocating for historically underrepresented patient populations. Dr. Sarah Song is an associate professor in the Department of Neurological Sciences at Rush University Medical Center. She serves on several editorial boards of medical publications and has been published in numerous journals, including on race and ethnic stroke disparities, acute stroke systems of care, women and stroke, and community-partnered education interventions in Asian American populations. Again, we've got a stellar panelist joining us today, and I look forward to our shared conversation. And welcome to everybody who's joining us via YouTube as well as Facebook. Before we begin our conversation with our distinguished panel, I'd like to acknowledge, for those that are just tuning in now, we will be using the acronyms AA for Asian American, NH for Native Hawaiians, and PI for Pacific Islanders. And again, as a friendly reminder for those of you who are joining us on Facebook and YouTube, we encourage you to use the comment section to ask questions that may arise during the discussion. And we know we'll get to at least a few of your questions during the Q&A session at the end of this panel. So before we begin, we've asked our panelists to respond to our questions today in about 2 or 3 minute responses so that we have an opportunity to hear from all of you. I'm going to kick off our first question, which will go to our full panel. I'll start with Mary Jo, and then go to Sarah, and then Linda. So as our opening question, how can we make sure that our community is well represented in health policy discussions? Mary Jo?
Thank you so much, Juliet. First of all, thank you for this opportunity to be part of this panel together with other distinguished leaders. I think each one of us in our community has to take that responsibility and really begin in knowing what district we belong to and who represents us in Congress. As an immigrant nurse, many of us are not familiar with the legislative branch of the government and how it works. We relegate this to other people while we focus in rebuilding our life by prioritizing our family and advancing our career. However, it is important to understand how to belong to an organization and the impact that we can in being active. I came to know the importance of representation when I visited Albany in 2004. I remember taking the Amtrak together with Miss Lolita Compas, who was the first Filipino nurse to be the president of the New York State Nurses Association. I was feeling nervous, just like what I'm doing right now, when I met Senator Liz Krueger. But after my 30-second elevator speech, I relaxed and focused on what I need to do, explaining the number of nurses who have suffered back injury and the need for ergonomic measures in the workplace to prevent accidents and minimize skeletal injuries. Just like what Representative Scott have alluded earlier, I know that our testimony and how we explain this to legislators help in molding those policies. So I hope that through this legislative process, that we can have a mentor, and we need to know our resources in the community, especially if we are in our leadership role.
Great, thank you for that. I'm going to turn to Sarah now. Sarah.
Hi, thank you so much for having me here. I'm just really excited to be part of this conversation. And in thinking about this question, I thought, first of all, we need more research. We need to understand the lay of the land. We need to understand what's happening in our communities in terms of risk factors and health outcomes. And the problem is that Asian American health disparities has been historically underfunded. And what we also know is that most research isn't broken down by Asian subgroups. So, we know that not all Asian American subgroups have the same risk factors, same cultural background, and we need to be able to tell people what the data means and what it's missing. I remember once I was applying for grants in the Korean senior population in Chicago, and I kept getting turned down, and the feedback was always, you can't just study Koreans, it's too narrow. you need to expand it to include all Asian Americans. And I was like, I don't know how to tell you, but that doesn't work, right? So I ended up basically taking one study and then calling it Asian American, and then running a Chinese American and a Korean American study on 2 different paths with half the money, because that was the only way I could get funded. And that leads to my second point, which is education. So we need to educate others who aren't in our community about who our community is, who it cares about, and what matters to us. And we need to educate on everything from how we get our health information to the people who are most vulnerable, how they're getting their health information and where they're going to get their health. And we need to explain why one size fits all when it comes to health policy isn't necessarily the best thing. And to really do that well is my last point, engagement. And we need to be really fully engaged in every process of health policy making from the ground up. Every one of us has a unique voice. We need to make our voices heard and have a seat at the table. And, you know, we need to speak up when something isn't equitable or decisions are made for us. And we need to advocate for ourselves. And I really saw this in my own state in Illinois. You know, this is something separate, but as an example, I saw that there was a need for neurologists to speak up for themselves because there was lots of things happening, and state legislature was passing laws and regulations that affected our practice. So I actually, knowing nothing really about how to do it, I started the Illinois State Neurological Society, where all neurologists could kind of come and coalesce and speak up to the legislator for ourselves. And in doing that, we've been able to be more powerful. So I really see, you know, all of us needing to just start somewhere. It doesn't matter where, just get engaged and stay engaged. Thank you.
That's terrific, Sarah. Thank you. Linda, I'm going to turn to you now.
Great. Thank you so much, Sarah. I feel like you were in my brain as you were making your remarks, and I really couldn't agree more. I feel like really enabling the perspective from the community level is so critical. Really kind of training the community to share unique story, unique perspective, whether it's on behalf of patients, a loved one. So many of us are caretakers. I feel like that story is something that policymakers are hungry for, companies are hungry for. And as we want to influence and make sure that there is a clear understanding that our community is so diverse, we need deaggregated data. We are our best advocates inside of institutions and companies to say, we need to go to the community and understand the varying perspectives. Working with advocacy groups at the community level, I find specialized resourcing and the ability to really make connections among groups for shared resources is one very powerful way to enable communities not to have to reinvent the wheel, but to be able to join together to really make meaningful change in our health policy system.
Great, thank you for that. So we've heard all of you mention the importance of creating space, making sure we have a seat at the table. This is a great opportunity to hear from Mary Joy, so that all of us can have a better appreciation for those of us that are in the healthcare workforce. So Mary Joy, could you share with us the role that Filipino nurses play in the U.S. healthcare workforce? And we've also talked about the importance of sharing narrative. Could you also share a story or two about the contributions of Filipino nurses, especially during COVID-19 and this pandemic? Mary Joy?
That's really a heartfelt question for many of us. I came across this quote that our cap is the passport to the world, which is a symbolic representation of the importance of Filipino nurses, as well as other foreign-trained nurses, in having the opportunity through our profession to be an essential partner in the healthcare delivery process. As everyone knows, the Philippines have been the highest source of foreign-trained nurses in the United States and other parts of the world in addressing nursing shortage globally. The dependence on foreign-trained nurses, particularly Filipino nurses, and the unprecedented COVID-19 pandemic highlights the importance of immigrant healthcare workers in the American labor market. I know that there are over 150,000 Filipino nurses that make up 4% of the nursing workforce amongst 4 million nurses in the United States. One word that comes to everyone's mind to describe a Filipino nurse is care. Our training and education is at par with the Western education, plus our work ethic, our respect to our elders, and loyalty to service contributed to our reputation as caring and compassionate professional nurses. So I think if there's one word that I would want people to remember is how Filipino nurses really care, especially during this pandemic crisis. It really hit the Philippine Nurses Association of America close to home. And I remember during the surge of the pandemic, our own president, Madeline Lieu, got sick of COVID. Mm. Her husband was hospitalized. Both of them were in the hospital. I had to step in as the president of the Philippine Nurses Association of America. And that really hit home for all of us with 55 chapters and over 5,000 members all across the United States. We launched the Heal Our Nurses campaign as part of our COVID-19 task force. We know at the time that there's a need for protective equipment for our nurses. We were able to deliver over 10,000 face cloth masks to our members. Majority of our chapters have also did in their own way contributed in delivering surgical masks and other N95 masks to nursing homes and other hospitals. We worked with community organizations that donated face shields, and we distributed this to various parts of the country in our Western region, North Central, South Central, and Eastern region. A lot of our retired nurses went to sewing face masks and actually just delivering this to people in the community. And some of our chapters fundraised in trying to donate money to the food bank. But even prior to the pandemic, we have contributed to some of the legislations here in this country. In 1989, when there was supposed to be a deportation of over thousands of nurses, one of our past president in PNAA, Filipinas Lowery, testified in Congress on why it is important to put a stop for the deportation of nurses, because this will paralyze the healthcare system. And as a result of that, the Nurse Relief Act allowed a lot of us to be here in the United States and continue to contribute to society in general. So this pandemic will continue to exist, but our contribution will hopefully be appreciated by future generations.
Mary Jo, I just really want to thank you for sharing that really that soulful response, and I think, you know, especially given where we are with today's health summit, you know, I would just invite and ask all of us just to take a moment of silence just to acknowledge and appreciate all of our incredible frontline workers and our essential workers. So Mary Joy, in today's conversation, thank you so very much for grounding us on all the incredible contributions Filipino nurses have made and all of our frontline workers, particularly from our community. So I'm going to shift here to Sarah. Sarah, you talked about making sure that unmet needs are highlighted, that we can influence particular decisions, and this can make a big importance when it comes to allocation of resources. So could you share with us, how has your work on community-partnered education interventions with Asian Americans really illustrated the need for more diversity in the healthcare workforce? Sarah?
Thank you. And thank you for that story, Rachel. It was so powerful. So just to ground us in healthcare, as many of us know, Asian Americans have been seen to have poor outcomes. And for example, in my field, which is stroke neurology, to have more severe strokes and to do worse after strokes. And this is for a lot of reasons, again, that many of us know, everything from linguistic to cultural barriers, a difficulty with access to meaningful and effective health resources and health education. And add to that unique socioeconomic factors, and you've got a big problem. And most Asian American patients who are less proficient in English prefer to have doctors who speak their language. And even in Los Angeles, where I did my training, I saw that there was a real need to not only translate words, but to also translate cultural meaning. Like take, for example, a nutritional pamphlet that talks about, how to adapt a meal of like turkey and multi-grain bread, and then you just translate it and give it to a Chinese senior population. They're going to be like, what does this mean to me? So, our seniors are our most vulnerable population. And I was able to focus some of my research in Koreatown on the Los Angeles senior population. And I used a community-based participatory research, or CBPR approach, which is an approach that I think is really useful for minority populations, like different Asian American populations. And, traditional research, you might think of somebody saying, a researcher saying, I think I want to study this. And I'm going to go into your community. I'm going to tell you what the problem is. I'm going to tell you what I think we need to do to measure the problem. And then I'm going to propose to you how to fix it, tell you what the important outcomes are and what we do with that, right? And then I just walk away. And I mean, that's a very basic reduction of research, and it's kind of mean, but that does still happen. Instead, CBPR is kind of the opposite approach, where the community is considered an equal partner within the research. So they help you determine what the question should be, what the need is, and they tell you what's the best way to, recruit people. Do you think people would want to do it? And so it's truly collaborative, and then they're able to take the information that they learn from that research and really use it in their community to make it sustainable. So it's really effective. And the way I got into this was I thought about how my own grandparents would be if they had a stroke, right? So I'm a stroke doctor, that's what I do. And the people I care most about may not do what I think they should do, right? So my grandparents would probably, if they had stroke symptoms, they go into their bedroom, they close the door, they wouldn't want to be a burden, they wouldn't want to say anything. And then next thing you know, their outcomes are much worse, because stroke is a very time-sensitive disease. And I also thought about where my parents and my grandparents get their health information. And it's not, the typical means, right? It's K-drama, it's the newspaper, which they still get delivered on their doorstep every day. It's church. So we worked for over a year with community members to develop a project that included everything from surveys, to understand the lay of the land, focus groups to hone in on important topics, and finally an intervention that we were able to do in sort of locations that were familiar to Korean American seniors, like churches and senior centers and things like that. And one story I want to tell you is from a focus group that we did that really illustrates the need for diversity in the workforce. So we were talking about health and stroke and responses to stroke. And one focus group participant shared that, his brother-in-law had gone to the hospital because his brother-in-law's wife was having a stroke. And so they were driving quickly to the hospital, and then he took his fist and he smashed the rear view mirror. And he took a shard of glass and he slashed her arm to let the black blood out. And black blood is a very common cultural belief that the blood is bad, and that if you release it, you'll get rid of the bad blood. And when he went to the hospital, they brought his wife into the ER. The doctor said to him, good job, good job. He just kept saying, good job. And, as a doctor, I think that he probably meant good job for getting to the hospital so quickly. But he translated that as meaning good job for doing this thing with the mirror shard and slashing his wife's arm. So he actually proceeded to tell everybody in his church group, everybody in his family, that this is what you should do if you have a stroke. You should cut them. And so this is an example when just translating isn't enough. We need healthcare providers who are really going to dig deep and understand the culture where people are coming from. And that means that we need to speak up for, our communities, and we need to get into the workforce, get trained in healthcare, get trained in cultural competency. And it's about understanding not only what symptoms somebody's presenting with, but where they're coming from and what their background is.
Sarah, thank you for that. That was a really, really educational response, and thank you for sharing, the community and the cultural context, but also the linguistic context there. I'm going to turn to Linda. Linda, how wonderful we have this diverse panel, and you're joining us, if I may, from the industry side or the corporate side. So could I ask you in twofold, could you share a little bit more about what your role is so that our audience can understand your role and the fact that your role does exist in industry? And then as a follow-up, how do companies engage historically underrepresented patient populations and community-based organizations?
Absolutely. Thanks for the question and the opportunity to share. So I have the intense pleasure of getting to work with patient advocacy groups. So your typical nonprofits. And I do a lot of specialized work with community groups that represent the underrepresented community, whether that's African American, the Latinx, certainly the AA and AAPI community. And what's great is I get to support the community-based organizations in the work they're doing in community. My job covers oncology and now also the osteoporosis portfolio for Amgen. So we know that osteoporosis overrepresents in the Asian community. And what is really interesting about that, to Sarah's point, when you are educating, when you're talking about a disease that is kind of a silent hidden disease, you have to do it in a very specialized way. The great thing about working for a company is I bring that voice back inside and I get to work with all of my cross-functional partners. So our medical team, our early development team, the researchers, our marketers, those who focus on access issues, because we know if we have these amazing treatments, but patients can't access them, that creates a huge issue. So what's fabulous about my company and all companies similar in my industry, we all have this role and we all have professionals who focus specifically to make sure that patient groups and community groups are supported and have support and that we're taking the voice back inside. So a truly fantastic opportunity, I think, and one that every day I wake up, it's a different great opportunity, great patients that I get to work with. But again, at the end of the day, it really is about that individualized community that I am trying to both support and highlight their perspective. Some of the great things that as a company we get to do and we get to focus on, internally we have a huge initiative to make sure that we have a diversified workforce, that we are a place where everybody feels like they can bring themselves to work, that we are very culturally competent, where communication and we have employee resource groups, we do specialized recruitment. I feel like all of these kind of programs really do help to diversify the pipeline. We have programs around our clinical trials, really from the early identification of molecules and thinking about how, if we're going to create a clinical trial, it is appropriate that we have appropriate representation. We know talking to various communities and patients about what a clinical trial looks like, their willingness to participate, what that might mean. We know it's important to work with the healthcare community also. Like, who are they talking to about the trials and where are the trials located? So really we have the great opportunity to work kind of in a very, very broad scale, kind of from early through treatment, and then really making sure that at a policy level, we're incredibly engaged. My colleague, Howard, who works very closely with APAICS, we have the opportunity to support initiatives and organizations like this. I hope that kind of gives you a broad answer.
I think that's terrific, Linda, and it provides a better understanding in terms of why partnerships and engaging with industry partners is critical, especially for the conversation that we're sharing today. So I'm going to shift gears here. This is for the full panel. Because you represent different parts of the healthcare workforce, Are there ways we can urge medical professionals and institutions to practice more culturally relevant, culturally competent, and linguistically appropriate healthcare? I think each of you have touched upon this a little bit here and there, but just appreciating who our audience is. And we know we have different members of Congress joining us today. If you could respond to how can we urge medical professionals as well as institutions to practice more culturally relevant and linguistically appropriate healthcare? This go around, I'm going to mix up the order. I'm going to start with Sarah, go back to Mary Jo, Joy, and then turn to Linda. Sarah.
Thank you for this question. I think there's truly a sense of urgency around this issue. We understand that usual care doesn't apply to minority populations. And one easy way to do this, well, it's easy in concept, is to make sure that our workforce is diverse. So that means recruiting strong candidates early on in the pipeline, mentorship is extremely strong, and making sure that these connections stay tight. And we want people to feel included and not excluded when they come to hospital visits. Briefly, I'm actually the vice chair of the medical school admissions committee at Rush. And one of the things we really look at is say, how can we recruit doctors to our institution who look like the community around us? And similarly, so in the Asian American community, we want to make sure that we're well represented. Another seemingly simple way is just to make sure that healthcare providers are using translation services. I went into how translation alone is not enough, but how much worse is it if you don't have proper translation? And I've seen doctors and nurses forego this step. Maybe if it's not available, only some language are available. But I think that we need to make sure that everybody gets heard. Like when a patient comes in, let's say that they're by themselves, they don't speak the language, how much more difficult is it for them if you can't communicate with them and they can't tell you what's going on? And finally, I think that, and I'm very involved in medical school education, so I think that we really need to teach our medical professionals to be compassionate, to take time, and to listen, and to be less judgmental of other cultures. There's so much going on in a busy healthcare setting, and sometimes there may be people who don't agree with your diagnosis, and they may just be coming from a different place. So what I always teach my students, my residents, and my fellows is stop, take time, sit down, understand where your patients are coming from, give them a moment of your day, right? And just really listen to them and where they're coming from, not just what their symptoms are. Thank you.
Great. Thank you so much for that, Sarah. I'm going to turn to Mary Joy.
I couldn't agree more with what Sarah had elaborated. I know similarly in nursing, we struggle with the same issue of diversity and also making sure that we're able to relate with our patients. Similar to Sarah's experience, we do have incorporation of interpreter services in our organizations. And I know that this is really part of that requirements. Putting on my informatics nurse hat, we know that this is a requirement in our medical health record in assessing the need for interpretation services. But at the same time, we also need to look at where is this patient going back? How is this care going to continue back in the community? And I'm going to switch my hat and put my PNAA volunteer hat. When we go to our community-based participatory research, it is heartwarming that we have support from organizations like API, AHF, and NYU Center for the Study of Asian American Health that really look into the social determinants of health and how do we sort of like help our patients have a better understanding and management of their diabetes or their hypertension. And this is where, in terms of culturally and linguistically congruent ways, we can teach them through our own dialect. We have a lot of volunteers that are willing to do that. At the same time, we need to work with the Department of Health in terms of looking at the materials that our population could access and translate this in a language that is really relatable for our patients. because that's the only way for them to sustain and continue with the care that we provide from the hospital back to the community. And I think it's important to emphasize that language is not the same for all Asian communities. Sometimes people mistake us because we look the same, that we speak the same language. In fact, for the Philippines alone, we have over 160 plus dialects. So that in itself is a challenge in terms of communication. So this is where the importance of really understanding who the patients are, where are they going back to the community, and how are they going to get the resources that they need to take care of themselves.
Great, thank you, Mary Choi. Linda.
Yes, thank you. I think one of the ways from an industry perspective where we can be supportive, we work with many of the professional medical societies and the APNP societies. And I think a number of our partners have training programs, and from an industry perspective, supporting and encouraging the development and the deployment of the programs to encourage HCPs, newly and long serving, to think about the importance of cultural competency and communication and how important that is. Large academic centers tend to be highly resourced, and what we see is that in the oncology space, a majority of patients are seen at the community level. And so making sure you have widespread programming that can be tailored and specialized, we feel is really critical.
Wonderful, I appreciate that. Okay, so I'm going to do a quick time. We're doing pretty well here on time. Just to share where we are in our discussion. We're going to close out this portion of the conversation, and then we do have some time for Q&A. So appreciating our theme this Health Summit is to rise up to the challenges that we're facing after a year under the pandemic. To wrap up this portion of the panel discussion, what I'd like to ask of all of our panelists is, from your vantage point, how are Asian Americans, Native Hawaiians, and Pacific Islanders rising to the challenge of the need for more diversity and equity in the workforce? And here I will start with Linda, Mary Joy, and then Sarah. So the question is, how are Asian Americans, Native Hawaiians, and Pacific Islanders rising to the challenge of increased diversity and equity in the workforce? Linda?
Definitely, thank you. Well, I think back to starting my career about 30 years ago, and the few number of colleagues I had that looked like me. And I think to now, and I think to my youngest, who is 22, and how diverse not just my peers have become, but certainly when I ask her about, not just school, but internships, the diversity is really increasing. And I feel like kind of that personal experience, I don't have to hunt for my peer group. And so for me, it is about mentorship. It's about talking about what I do, what my colleagues do, and making sure that there is a strong pipeline, that there are mentors and folks who will help them along the way. I feel like that is, I was helped along the way. I had the opportunity of amazing mentors. And I feel like the more we can do that and we can be that pipeline, the more we're going to see amazing fellow professionals and really growing the field.
Great, thanks, Linda. Let me go to Sarah. Sarah.
Okay. I could not agree more. You took the words right out of my mouth. I mean, mentorship, making sure that there is an opportunity for people at a young age to get interested in the healthcare workforce, and really making deliberate moves to encourage AA and NHPI individuals to step up to the plate. I think that people recognize how useful and helpful and informative having a diverse workforce really is. And, that really helps along the way. Yeah, I mean, even in my own medical school here, I have students coming from all over the place. They just knock on my door and they say, hey, I'm so-and-so, and, I just want to talk. And I think that that's great. And I think that as much as we can do to reach out to people at all levels of education is so important.
And Mary Joy.
I couldn't agree more with both our panel speakers. Just like how I started my story, the importance of role modeling is really what brought me here now, and having the courage to just speak up. I think it's powerful for a young girl who sees faces in the media that looks like us, and be dreaming that I can be that person. And I think it resonates to a lot of us, especially for me, who migrated from the Philippines, right? So we have to not only change the narrative, but really live the narrative and share that story, because there are so many successful people in our community that are humble, and we always feel that we don't need to share what we do. But I think we need to do that as leaders in our community, so we could continue to showcase the importance of the work that we do.
Great. Thanks for that. Okay, so we're gonna pivot now. We've been receiving some great comments and questions from our audience. So I'm going to start with Sarah and Linda, and I think this is really goes to allyship and coalition building. All of us are appreciating the devastating consequences of COVID and how it's impacting communities of color, particularly our community, but taking a broader lens and thinking about allyship and coalition. From where you sit, what sort of support do you see from other communities of color where we can help support each other when it comes to enhancing healthcare and really driving towards health equity? Let me start with Sarah, and then I'll go to Linda. Sarah?
You know, it's been a really trying time for, I'd say, not only, AA, NHPI members of the community, but for all, race, ethnic minorities during this time, just to see such stark disparities in outcomes from COVID. And, actually, you may not know this, but a lot of other health conditions outcomes have worsened because people are afraid to go to the hospital. They're afraid to seek care, even though it may be perfectly safe for them to do so, given certain precautions. So it's been a really trying time. And you add to that the surge of racism that we've seen. And I've had, young doctors come to me and tell me that they've been, spoken to poorly in the workplace setting by patients who may not understand. So I'd say that, continuing the conversation, continuing to write editorials, wherever you can speak up and say something, you should say something. It's like that. If you see something, say something, but you should say something, because as your community becomes more diverse, these voices become so much more important. So for example, I had some medical students who came to me and they wanted to write an editorial about racism and sort of the model minority myth of Asian American physicians and how it was impacting them in their medical education. And I helped them write that, and that was published on Kevin MD. And I think that just doing something is important.
Thank you for that, Sarah. Okay, this one, I think I'm going to share this question with Mary Joy, and I think it has to do with community education, outreach, and technology. I'm going to go ahead and read this one. I'm a nurse educator, and I have challenges in educating the Philam community because of COVID-19. I used to do face-to-face education during health fairs, but unable to do that now. I don't have that problem with our nurses because we've done live webinars via Zoom. What are your strategies in educating the Philam community and other minority immigrant communities who don't have access to technology? Mary Joy?
That's a very good question. Myself have experienced that. We are a multi-generational family. In fact, I live with my mother-in-law and father-in-law. It's a two-family house, but because they were so used to doing exercise and going to senior centers, they were so frustrated during the pandemic. And I have to teach them how to do it. And now my mother-in-law is just doing Zumba 3 times a week virtually. So I think there are resources that we have in the community that can facilitate and teach our elder population and also those that are not familiar with technology. In fact, within PNAA, we have created a significant interest group, Nursing Informatics, to exactly do this kind of outreach. We partner with our Kalusugan Coalition, so this way we can promote ways on how to promote the use of technology, and we are working together with other community organizations to disseminate the information. So I think once you show one and teach one, and then they'll be able to multiply that.
That's great. That's great. Thank you for that, Mary Joy. This one I'm going to turn to Linda. Linda, you talked about Amgen and industry really making efforts to creating a more inclusive and diverse workforce. For the good and the benefit of the audience, could you highlight perhaps a couple of strategies that Amgen has leveraged for really cultivating a more inclusive and diverse workforce?
Absolutely. So I think for Amgen, we really focus on specialized recruitment. So we know that certainly when you have the new graduates, COVID had a huge impact. Recruiting fairs weren't happening. It was difficult and challenging to immediately pivot to the virtual setting. So Amgen, like other biopharmaceutical companies, will go to certain institutions. And I think for us, it was really taking a moment to think about where we were going. Right? It's like your workforce is going to look like the institutions that you go and you recruit from. And so taking a moment to say, are we going to a broad representative number of colleges? Are we going to, grad schools that are tailored? Of course, we want to make sure that we're looking for those specialized degrees, but we needed to take a really hard look and make sure that we were broadening. And I think for us, it was also taking a look at, are we looking at kind of the unique pieces that we want to see at Amgen, whether you're talking about the veteran population, you're talking about, we're a California-based company, and we were heavily West Coast. And so I think a lot of that too was, broadening and going to the East Coast. But again, for us, it was really wanting to make sure that we were broadly representative. I feel like having the benefit of being at a West Coast company, the diversity is impressive. Like walking onto campus feels like a completely different experience than walking onto a campus of one of my East Coast colleagues in the industry. So I feel like that's a definite benefit. But we not only recruit, but we make sure that we are a place where people feel comfortable and they want to be. And I really cannot underscore that enough. It's one thing to go to institutions and recruit a great employee base, but we want to keep them. So we want to make sure that there's great opportunity, that it looks like a number of things, that we're creating a real feel that they are welcome and their perspective is welcome and really embraced.
Great, thank you, Linda. Here's our last question from our Q&A, and then we'll be moving into closing remarks. Mary Joy, I'm going to turn this one to you as well. This is really, again, as we close out our conversation, just acknowledging the devastating loss of life that we've all experienced across the country and the impact on our families. Really, how can we support our frontline workers? There's also a question about what can government do. But I think the question here is how can we collectively better support our frontline workers? And if you'll allow me, I just wanted to read the comment here. There are a lot of fill-in nurses working in the front lines, and it's very sad to hear from colleagues and friends when another nurse is sick or passes away. So again, really in the spirit of what can we individually, but also in our day jobs, do a better job of supporting and acknowledging our frontline workers. Mary Joy?
Absolutely. The year 2020 was the year of the nurse, and we were so looking forward to celebrating that. And a lot of people, especially in the community, honored us as superheroes. But we know that despite that recognition, a lot of us suffered with psychological distress and moral injury. Some of the nurses that I used to work at Bellevue, I know like 3 or 4 that passed away. And much as that happened last year, it still affects us emotionally. So I think programs that would really promote resilience in our community, and at the same time looking at peer-to-peer support. In fact, our organization is launching our Kabalikat program, which is culturally tailored, because obviously in our culture, seeking for mental health has a stigma associated to it. We are seen as caregivers, but at the same time, we keep things to ourselves because we want to be the strong person in our family. And I think that's what's important, providing that psychosocial, emotional, and mental well-being for our nurses. We also know that some nurses were impacted economically, some were furloughed. So benefits that would really provide for long-term employment for our nurses would also be needed to be looked at as part of the policy and legislations. How do we support these nurses that have lost their jobs?
Thank you for that, Mary Joy. And I think we especially appreciate, you said so many wonderful, very important things there, but also us as a community just collectively acknowledging, encouraging that we do, like other communities, we do face stigma when seeking mental health services and support. So I don't think we can underscore enough that it's important for us individually and as a community to encourage our family members to seek mental health services and supports. Okay, well, I have really enjoyed our discussion and learned so much from you. I hope the audience, you will agree. So as we wind down in our last few minutes here, I'd like to ask our panelists if you could just share a brief closing remark. And I will start with Mary Joy, and then go to Sarah, and then Linda. Mary Joy.
I know, Juliet, that we talk about this, and the one thing that I would want for us to really remember, and putting again my informatics hat, is a quote from Norma Lang. If you cannot name it, you cannot practice it, you cannot teach it, you can't pay for it, you can't research it, and you cannot put it into public policy. And we know that even prior to COVID-19, we are already underrepresented. So it's really important for us to put our voices together. And I would like to thank the organizers for this opportunity to hear our nurses' voice and story.
Thank you, Mary Joy. Sarah.
I think it's really simple. I would say show up, show people who you are, be engaged, pick a way, any way. And just remember, you can be an advocate for your community in a way that other people cannot. So no step too small.
No step too small. Thank you, Sarah. Linda, close us out, please.
Definitely. Well, I feel like Mary Joy, your quote was beautiful, and Sarah, your message as well. I would just say it's about mentorship and helping those who are going to come behind us. And APAICS for putting together an amazing event. On behalf of Amgen, we're just thrilled to be a partner and continue the great work.
Thank you for that, Linda. Well, this concludes our panel on diversity, equity, and the healthcare industry workspace. We've heard themes of growing the pipeline, mentorship, building resiliency, lifting each other up, allyship, and really just promoting all that our communities do have to offer. Thank you so much for joining us today, for watching. At this point, we'll take a 30-minute break before our next panel. Thank you, everyone.